Here the patient's working on lateral jumping stability. Good form, isometric contraction to the legs as he's pushing off concentrically, loading the legs eccentrically, taking weight through his patellar tendon, but in an environment that only weighs 1/3 his body weight, which he would be unable to perform on land at this time. Here you can see the patient pushing off the angled platform, allowing for good ankle, knee, and hip proprioceptive training while he is jumping laterally in the pool. He is also running against a current at about level 4, causing increased movement and resistance in a forward and backward plane. Here the patient's performing the same exercise, but we have reversed his direction, and he is loading the ankle, calf, hamstring, but with the current pushing into his backside, changing his proprioception and angle of resistance, adding additional challenges to his workout. So here the patient is in a sideline position, half on the bench, half off the bench, pushing into the current with additional resistance with a straight leg, hip adduction / hip flexion isolated pattern with minimal to no resistance going through the hip joint, knee joint, or ankle joint, but effectively working his core stabilizers and hip musculature. Here the patient's laying supine, holding on to the front of the pool. You can see where the current comes out of the grate, and he is working on single leg reciprocal motions, working on full extension of the hip and the knee to try to get into a more running dynamic position. Here he is doing more core strengthening, bringing both legs up to his abdomen, but he's also working against the resistance as the water hits his thighs and his hip flexors with no weight bearing going through any joints